I'm going to tell you my first thought on psoriasis this year. This is going to be the year of oral drugs for psoriasis.
Yes.
Right? Because like Otezla is not that, just it's safe, but not that effective. So TIC2, I'm honestly, I was puzzled. I don't know why TIC2 didn't do better commercially than it has. Kind of what people have told me is it's got a little bit of safety issue and the efficacy's just not good enough to make it like taking that little bit of safety issue-ness. But this year we're going to have the icotrokinra and zasocitinib should both be coming out this year. So right, the icotrokinra, I can never say. I don't know how to say it.
Yeah,
but it's the J&J oral. It's an oral peptide that blocks IL-23. So it's quote a biologic in a pill. It's fat. Like whenever you're like, but it should get digested. Like 99% of it does get digested. It only has 1% bioavailability. But if you give it every day, you get that 1%'s enough. So that and zasocitinib is like the next generation. So TIC2,
right.
So it's a TIC2 inhibitor, but it's got higher specificity, higher dosing. And so both of those drugs look really good. So like, I think they're getting PASI, 90 numbers over 50%. They're getting PASI 75s into like the 80% range. So they're kind of how Laura Ferris, who's like she's the psoriasis expert on terms of drugs. She said sort of that she thinks of, so TIC2 is kind of equivalent to Stelara in terms of efficacy. And she thinks of these new guys as kind of Cosentyx / Taltz in terms of efficacy. And the IL-23 looks like it's probably not going to have any safety issues. The zasocitinib, because it's a more selective TIC2, maybe it won't have like the little, well, maybe you should check them for TB that like was in but it's certainly going to be, both of these drugs are coming out with head-to-heads against TIC2. So we'll know that they are much better than TIC2. Maybe this will be like when, we go back to using orals for psoriasis. Don't know.
But yeah, I totally agree. I think that the TIC2 quandary was you still needed labs and the efficacy never really matched any of the biologics, right? The ones that we typically use at this point.
Yeah.
And Otezla, no labs, easy to kind of set it and forget it. You might get a little headache. You may get some depression, some weight loss, but you take those risks because there's no labs. It's easy to get started.
Yeah. And those risks are all harmless, right? They're annoying. Yeah. If they happen, stop the drug. We'll do something else.
Yeah, exactly. But here we have exactly. I mean, we're so excited about this new class of highly effective oral therapies. I think it's a brand new class of drug. I don't want to just call them orals because then you lump them in with the others. Yeah. So I'm trying to get everybody to call them highly effective oral therapies.
I like that, right? So just like in AD, our term is advanced systemic therapies.
Yeah.
Right. Because you don't just want to say systemics. Yeah. I like this highly effective oral options. It somehow that has a ring to me of like extra virgin olive oil.
Yeah, exactly.
Like you need
first pressed. Yeah.
You need to get a V in there so you can call them like Hevos or something.
Yeah. Well, I'm very excited about. So the icotrokinra now has a trademark named it's Icotide.
Oh, so, yeah. I hadn't heard that. Icotide. Yeah. I can see that. I can say.
Mm-hmm. You could say that, right? Because the other one's really difficult. There's too many syllables and way too many vowels. Yes. But Icotide, we could say, and it leans into the ico for iconic and tide for the peptide, the small peptide.
Oh,
and yeah. So we're excited about Icotide coming out. I think the PSA data will be really interesting as well, right? We think of that small molecule as being able to penetrate into the synovial tissue, maybe at a greater concentration than the antibodies, and hopefully.
So do you buy that story? Like I've heard it over like a number of times, and it sounds good, and it 100% could be true. I'm not like that. Sounds like crap. It sounds very true to me, but there's a lot of stuff that sounds good, and then it's kind of baloney.